Edmund is at Papworth for us tonight. Simon.
Janine, at this moment, 40 years ago, a dozen metres from this ward, the Royal Papworth Hospital had performed its first heart transplant operation. I think you can see some pictures of that surgery now. As you can see, it was very surgical led, and 1979 was a key year for this hospital as well, because come the summer it would be the first successful UK operation of a long-term patient, someone who would survive more than 5 years after having a transplant. And a man who's been behind hundreds of them over the past decade is Dr Clive Lewis. Dr Lewis, what has actually changed in the past 40 years?
Well, you may be surprised to hear that the surgery hasn't changed very much. The biggest change has been the drugs, suppressing the immune system and preventing rejection. And we have drugs today that we simply didn't have 40 years ago.
Is another key part the fact that you are involved as a cardiologist, actually looking after the patients before and after the surgery as well, to make sure that there's that longevity of life?
As a cardiologist, I'd say absolutely. Of course, we can't forget the surgeon because we can't do the operation without them. But it's a whole team, and it's the multidisciplinary team and bringing all of those different skills together that ensures great outcomes.
Big moment for the hospital today, but it was the 1960s when the first heart transplant operations took place. Why was there that 10-year gap?
Simply because the first outcomes were unfortunately not good. Over the subsequent years, very few transplant centres were transplanting, and towards the end of that decade, the outcomes got better. And that was the point at which Sir Terence English took the brave step of deciding the UK needed its own programme for transplant.
And you just hit the 1500th mark in terms of number of heart transplant operations. Almost quite a small number when you look at it over 40 years. Why is that? Is that because of lack of supply of organs?
It's always, we're very grateful to our donors. Unfortunately, there are always fewer donors than there are recipients waiting, and so people do die on the waiting list. And we do about 35 transplants every year traditionally, but in the recent years we've increased to about 50 transplants every year, and that puts us in the top tier, the top 10 centres of the world performing more than 50 a year.
So what does the future hold? Are you going to be growing organs in petri dishes or taking them from animals? What's the plan?
Both of those I'm sure will come, but the biggest thing for us is about increasing the number of donors, and we have a new DCD heart programme which has fantastically resulted in more and more transplants.
Dr Lewis, it's fascinating and important work, and a lot of that will now be moving to the new site near Addenbrooke's Hospital in April. Janine.
Thank you, Simon.